Good morning and welcome to COVID-19 Talk with local health authorities. With me is Dr. Sherri Onyiego, representing Harris County, Dr. David Persse, representing the City of Houston. This is sponsored by the Rotary Club of Houston. I am Stephen Williams, Director of the Houston Health Department. Let's start off with vaccines. There are vaccines that are on everybody's mind. CDC now said it is okay to mix Pfizer and Moderna shots in exceptional situations. Yesterday, Governor Abbott said our state is holding a second dose to make sure everyone it's available for those who already have received the first. He also said you do not have to get the second dose at the same location at first. Do you anticipate any shortages in this area?
So I'll take a stab at that one. So I think that the key thing to keep in mind that CDC has said is that it's in exceptional situations. The recommendation right now is still to try to keep the same brand that you received on the first dose consistent with what you receive on the second dose. And I mean, unless they're extremely rare or situations that really don't accommodate you getting that first one, I mean, they're still sticking with what the data has showed for the science that we know for these vaccines. We don't know enough to say that they can be interchangeable, but I think that's the key thing to keep in mind when CDC is saying exceptional situations. Yeah. And then as far as what we've been told from the state side, is that the second dose, it will be made available. And so in terms of anticipation of shortages, based on our information that we've been receiving, that the state is certainly making accommodations to ensure that jurisdictions will receive those second doses. But did you have?
Yeah, I was just say the same thing. So one thing is that wherever you got your first dose from, the state's going to get them your second dose.
That's right.
So if you go someplace else, you kind of screw up the order for, and we don't want any vaccine being wasted, right?
Right, absolutely.
And then the other thing to your point is that if you wind up, you'd have to be in a really exceptional situation to wind up getting a second dose from the different manufacturer. Right. I would not recommend that. We don't know about that at all.
That's right.
I'm kind of surprised when I said the governor said that. So.
Well, I'm going to come out and be a little bit stronger. I don't recommend it. You do that, you'll create more challenges for us as providers.
Absolutely.
If you, in fact, go seek that second dose from another provider. It is about, having enough of the second dose available for those people who you gave the first dose to. And so I don't recommend that. I know a lot of people are anxious about the second dose, but try to stick with that provider. Right. It might be a different physical location, but at least stick with that provider so that can be
Absolutely.
managed. CDC just said that it's still ideal to keep with the 21 or 28 days for the dose number 2. However, up to 42 days may be okay, and 43 days with Pfizer. Why does this keep changing? Is this is research-based? Why the delay in announcing? What happens if a person goes beyond those dates?
So I'll take a stab at that one. So when the vaccines were designed, they were designed in a way such they anticipated 21 days for Pfizer and 28 days for Moderna. And then in practice, when they actually did the study, they were able to keep most people within that 4 days before, 4 days after. Now, they came up with the 43 days in the Pfizer and the 42 for the Moderna because they had some odd situations where people were late, and as they tested them, it seemed like it was okay. But that's a time, I mean, you're skating on really thin ice there, right? So the vast majority of them were tested with 4 days before, 4 days after, and that's what we really need to stick with. Now, if you're in a crazy situation where you can't get it until day 6 after or day 10 after, I wouldn't get too bent out of shape about that, but don't think that I can wait till day 40. That's not the point.
That's right. That's right.
Yes. We're trying to stick within that time frame. I know some communications issues have come up, but we're in fact trying to stick with that time frame. LA has what is known as vaccine chasers who stand in an unofficial standby line for shots that may not be distributed. Is that possible in Houston, or are appointments strictly enforced?
Yeah, I think that there are probably some jurisdictions where that type of stuff is happening. I think that they may be creating proper opportunities for people to get it just in case there's additional doses left over at the end of some sort of community event. Yeah, I can't speak for everybody's efforts in terms of what their local patterns are, but certainly, I mean, I think that there's efforts going in for all of these vaccine providers to ensure that the doses that they have at the end of any type of community event is utilized and put into the arms of people who need to get them.
Yeah, I want to give you an example, though, because I don't want people thinking that there'll be hundreds of doses that are left over for people. Even when we were at Minute Maid and did the 6,400 folks. I think there was about 15 doses that we were trying to get into people's arms. So the question is whether or not it's really worth that. So it's not like you're going to create a half day of work or a quarter days of work or something like that. It's not plentiful.
Yeah, don't give people the impression that there's just this vast amount of leftover. Yeah.
We're talking about maybe a
minuscule
dozen at the most.
But you should never take it home.
Absolutely.
Unless you have permission to. Judge Hidalgo said signing up for the vaccine should not be like Hunger Games. The idea of Harris County vaccination portal is wonderful, though it seems to have been overloaded this week. What is the current status? Is it only for county location? Is every pharmacy and small distributor creating their own mechanism? If so, can't these be included in the portal?
Well, I can tell you a little bit about just high level about the actual smart waitlist process. And so the idea is that it allows for individuals across the county to sign up. And keep in mind that Harris County has been designed as a vaccine hub by the state, so it's open. And so essentially the idea behind individuals signing up faster than the next person really creates an inequitable process. And so this process, by signing up and then fitting into the criteria that the state has based on 1A, 1B, is really an equitable process. And then once those individuals are on that wait list, they're essentially randomized based on 1A and 1B, certainly with 1As being the healthcare workers and 1Bs based on the age. So the older patient population will certainly get it ahead of a younger patient population. And then once those individuals are randomized and selected, then they'll get notification to come and get their vaccine. So that's really the process by which the smart waitlist works. Right now, we have probably over 50,000 individuals who have signed up on that waitlist. But I don't know what processes are in place for other vaccine providers. I certainly hope that there's a sort of a universal common system that exists, because I do realize that there's quite a bit of community frustration.
Is the wait list still open?
The wait list is still open.
So that 50 could go to 100?
Exactly.
Okay. One study indicated that mRNA vaccines may need to be updated periodically to avoid potential loss of clinical efficacy. Others say the current vaccine is fine. When a final determination is made, if needed, will we be contacted to return for another shot?
Well, so two parts to that question. One is, do mRNA vaccines potentially need to be updated? And the answer is going to be yes, because we know that just like the flu virus, there's a genetic drift that occurs every year, which means it changes a little bit. What we were worrying about with these variants is genetic shifts, right? But it's entirely anticipatable that you may need a booster in a year or so. Is exactly how that would occur, I think we have to wait and see how the providers will go about that. That's a year from now. So we got a lot on our plates today. We'll worry about that a year from now.
Thank you for joining us for COVID-19 Talk with local health authorities. We'll be right back.
Hi, I'm Simone Biles. Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a champ.
Mask up, Houston.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Houston, we have a problem, more like a pandemic. Third ward to fifth ward, we can't afford to lose this. A-Leaf Acres Home, Sugarland, and Sunnyside. We know it's hard to stay inside. You are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. That keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. Please wash your hands and get tested. This is Houston, and we must protect the H.
The fight goes on, because just when you think this opponent seems to be pinned down, it comes back to life. So keep your guard up, because if your mask comes off, the fight is lost for all.
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Downtown is an art lover's dream with more than 65 pieces of public art.
Welcome back to COVID-19 Talk with Local Health Authorities. This is sponsored by the Rotary Club of Houston. Special thanks to Kathy Fenninger, past president of the Rotary Club of Houston, for providing these questions. Is the drive-through vaccine center safer than going into a facility if we have an option?
Well, I can tell you that the majority of our vaccine efforts on the county side are a drive-through model. We have medical personnel on site, we have EMS on site, and we have a dedicated observation area on site to ensure that safety protocols are in place.
Yeah. And actually, we are working with a partner to do drive-throughs, and we just started that this week, and actually it's run pretty smoothly. I think it is, in fact, safer.
Yeah.
How will we benefit from the American Rescue Plan announced by the President?
Well, if they're talking about the plan that the President came out with just a couple days ago for the COVID response. So in that plan, there wasn't, and nor would I have expected to be a lot of the detail that I'm looking for, right? But it's pointing, all indicators are pointing in the right direction to get us more vaccine, more quickly, more supplies, more support. So, how is it going to, I think we're going to see more opportunity for people to get vaccinated over the coming weeks once those resources hit the ground. Now, that's a big lift. I got to give it to the federal government. That's a huge lift. Let's not kid ourselves.
I've been responding to the V-Safe text and appreciate this check-in. Have there been any symptoms reported that have been surprising to health officials?
So one thing that came out actually this morning is that the Pfizer vaccine, for example, they're seeing fewer, and I don't know if this comes from V-Safe or not, but they're seeing fewer side effects or fewer severe allergic reactions. So they, so I know with the Moderna, it was 1 in 100,000, and I think with Pfizer, they're seeing around 1 in 200,000.
Yeah, I mean, I think that one other thing to just kind of piggyback off of that is that the V-Safe is a great tool for folks, when your time comes, or if you've already gotten vaccinated, or when your time comes to get vaccinated, certainly sign on to that tool, because I think it's a great way to really chart and have those, anything, to capture that type of information, because it certainly helps us to be able to answer those types of questions. But I do think it's a great tool, and the individuals really should take advantage of it. I mean, I signed up for it as well, so.
Should I get vaccinated? I currently have COVID. Can I or should I get vaccinated if I can do so safely via drive-through? If I am a long hauler with ongoing symptoms, if I keep testing positive, if I'm on antibiotics for an infection, if I have severe allergies, should I notify the vaccination site and bring an EpiPen?
Okay. A lot of those to unpack.
A lot of questions there, yeah.
How about 5 or 6 questions? Okay.
Yeah.
I'll take a crack at a couple. So one is, if you're currently infected with COVID and currently having COVID symptoms, no, do not go until you've cleared your symptoms.
Right.
Should you become somebody who is having continuing symptoms, it would depend on specifically what those symptoms are and how severe they are. So I'd suggest you talk to your doctor. In terms of if you've got a history of allergies, so the research so far indicates if you've had allergic reactions to injectable medications before, in particular vaccines, then you would be at increased risk of having an anaphylactic reaction. But if you've got an allergy to shellfish or to penicillin or to ragweed, then that really shouldn't be an issue. You shouldn't have to worry.
Right. And it might not be a bad idea to have an that's why at a lot of these community event sites, that's the main reason why medical personnel and EMS are there, to be able to respond to those kinds of things. I think there was another question about if I continue to test positive.
Yeah, if I keep testing positive, yeah.
Yeah, and I'm wondering if that's because, I mean, obviously we talked about this, very early in the pandemic as well, is that there are opportunities for people to continue to test over and over again, and they may be picking up a positive test, but it doesn't necessarily mean that they're actively they're actively infected. So I think that may be a question to sort of dive in a little bit further to try and figure out what the specifics are around that, because they may just be picking up dead virus, and it's just continuing to give them a positive test result.
What are the local vaccine goals, and what are the biggest barriers to achieving them?
Well, in short, our vaccine goal is herd immunity, which we will find out, it's probably going to be in the 70 to 80, maybe 85% if this becomes even more easily spread percent. So that's the goal. And the roadblocks right now, so, and I've talked about this before, it's, you know, the amount of vaccine available, our ability to get that vaccine into people, and then the demand from the public. And at any given point, one of those three things will be the rate limiting step. So today, it's the amount of vaccine that's available. Right. I look forward to the day when it's the second link, when it's us and our inability to mobilize enough people and get enough clinics up together to do it. And I fear the day when it's the third, when it's the people, we got all kinds of vaccine, we got the infrastructure in place, and nobody wants it. So,
most data collected when you're vaccinated does not include racial information. So how will this be tracked as equal distribution continues to be promised?
So it's requested, it's not required.
Well, it is requested.
Requested. We're finding, the data I looked at, we're getting about a third of people are not putting it in, about 2/3 are.
Yeah, and you know, with the immunization data portal that we're required to put that information in, that's why we're really educating our vaccine providers to try to get as much information as they can to help with that.
And one of the ways that we're trying to ensure equitable distribution is to make sure that we actually have providers in various communities.
Absolutely.
That is a first step, I think. Dr. James McCarthy of Memorial Hermann said we need to give about 50,000 vaccines per day to reach herd immunity. Will that be possible logistically? Yes. Go ahead. Answer is yes. Dr. Fauci projects herd immunity by the fall. President Biden mentioned this summer. The state of Texas appears to target expansion of eligibility to receive a vaccine in spring or summer. You have weighed in on this previously and said perhaps not until 2020. When can we realistically be able to have a large group event without a cap on attendees, given what you have recently heard, and what does your crystal ball say?
Well, you know, so my crystal ball goes back to the three things that I just said. Right now, we're limited by vaccine availability. Then maybe we'll have some infrastructure issues and then demand. But to this question is, when do we reach herd immunity so we can take the masks off and all gather? That's going to depend on, do enough people want to get vaccinated that we can get to that level where we feel safe that we can take the masks off?
Right.
Okay. The U.S. Press Secretary titled a platform called Tiberius is showing statistics on what has been distributed. This sounds like a powerful source, but I can't locate it. Would a county city be linking into this? Actually, Tiberius is, it's really a federal source, and we actually have a federal assignee that can access it, but it's not available to the public. One of my children and I tested positive several months ago, and we remain so. The family was always in close proximity. My other child now tested positive and is asymptomatic. Can we presume we all have the immunity, or should we keep testing? If so, how often? When can my kids return to school?
So I think it kind of hits. It kind of hits on what we were talking about earlier, because when you're testing repeatedly, even after symptom recovery, because remember, CDC had initially a time-based recovery strategy as well as a symptom-based recovery strategy, and so we don't necessarily follow that repeated test process anymore. And so I'm not sure if that's where they're continuing to see the positive test results come back over and over and over again. But typically, we're, for the most part, following a symptom-based recovery process for that.
And then the other part of that question is, what can we return to school or whatever? Is that, so we think that you may, from being ill, you may have some temporary immunity. It may be 3 months, maybe less, but you're not immune necessarily.
Right, right.
Thank you for joining us for COVID-19 Talk with Local Health Authorities, sponsored by Rotary Club of Houston. We'll be right back.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside, if you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask. And let's beat this virus so we can get back to the things we love. Mask up, America.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for Neighborhood Updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to Neighborhood Updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Wash, washy, wash, washy, wash, wash your hands. Scrub it while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to COVID-19 Talk with Local Health Authorities, sponsored by Rotary Club of Houston. There are quite a few questions left. I read speculation that children may be infected and be able to spread the virus and yet show no antibodies. Is that possible?
I don't know about not showing anybody, not showing symptoms.
Yeah.
Yeah, and I'll just also say, because I think they're also asking about neutralizing antibodies. That may be what they're referring to. So I think that one of the things that some of the studies have shown is that kids may have lower neutralizing antibodies in response to COVID compared to some adults, but that's because likely what we're seeing is that kids aren't impacted with more severe disease as adults are. So that's probably why they have a lower amount of antibodies, but it's those neutralizing antibodies.
Right.
I've been around family members who have been ill, but always test negative and have no antibodies. Is this unusual? They keep saying antibodies.
Yeah. Well, they may be getting antibody tested.
That might be it, but I think that I think one of the things that we still have to reinforce at least in that message is that, you know, if you're around folks that are, if you yourself are sick and not feeling well, really try to limit your activity from being around folks, regardless if it's COVID or not. I mean, I think that's the best way.
If I test positive and then 2 days later test negative, which test do I trust, or should I get a third?
The positive. and I'm not just saying that being, conservative. The reason is that it is very hard, it is possible, but it's hard to get a false positive. It is actually fairly easy to get a false negative.
Absolutely.
What happens to the annual flu cycle? Is the flu still a health concern? Yes.
Yes.
Is the flu vaccine still as critical since we're wearing masks?
Yes.
Yes.
Yes. Yeah.
A Forbes article on 12721 quotes an Israeli study that shows early indications that as many as 70% of people can still be infected after they have been vaccinated. It sounds as if, just like the flu vaccine, this one dose does not protect people from infections, just symptoms, presumably. We still need more data. Can you explain this?
Yeah, so I know I've got some familiarity with that article, and what they looked at is folks who had gotten their one shot before they got their second, what was the incidence of illness? And it was fairly high, reinforcing it's the second shot that drives it home.
Right.
Dr. Kloppman said we're beginning to flatten the curve. The reproduction level is below 1, and the TMC is looking good. Persse don't agree with that. Is the data from Harris County and the city different?
Well, I mean, our positivity rates are still high. I mean, they're coming down, but I mean, 18% is where we're at right now. And I mean, case-wise, we're still seeing upwards of 2,000 cases per day. So I mean, in the community, what we're still seeing is certainly a good amount of community spread.
Yeah.
An update on the wastewater project. You've been studying for this, Persse.
So, all right, so here's an update on the wastewater project, and this is confusing. So the amount of virus in the wastewater is really high. And we look at 38 different wastewater treatment plants, which cover differing sizing neighborhoods, if you will. And it's not neighborhoods, each one has multiple neighborhoods. But what we've seen in 17 of the 38 over the last 2 weeks, a slight decrease. In 7 of the 38, an increase. And in the remaining 14, it's remained basically the same over a 2-week period. What we've been seeing before, it was like that 7 and 17 were reversed. So every week there's some neighborhood that has a little bit, some neighborhood, it goes down a little because it's gonna do that, right? So right now we just happen to have a few more that are looking good than are looking bad, and it's been a while since we've seen that. Does that mean that everything's changing direction? No. We need to wait and see.
Is there value for me to double mask? Is that as good as having both people have their own mask?
Well, we always want people to, we want everybody to wear a mask. I mean, it makes sense for people to double mask. I mean,
double mask right now.
Yeah, to wear a double mask. It certainly makes sense. But the key is that everyone needs to mask individually. I mean, if you're going into more higher risk situations, it makes sense to try to wear a double mask, especially if you're on, like, you know, public transportation. You're in situations indoors where you're with people outside of your house. It certainly makes sense.
Let me add one quick thing. The thing about the double masking is that, yes, it adds more layers, but you could take one mask and make it thicker. But the thing of double masking is you actually have got double the pull, and so it makes the mask tighter.
Yeah.
So wearing two masks makes it actually a tighter fit.
It does.
So that's just as important as additional layers.
Absolutely.
Some hospitals are facing outbreaks of multi-drug-resistant organism infection, particularly in New Jersey. Given extreme cleaning protocols in hospitals to prevent COVID spread, how could this happen? Does this mean we should continue to stay away from hospitals if possible?
So I'll jump at this one first, but you probably think. So that is very true, but it's really unrelated to COVID. That is due to basically the overuse of antibiotics in our society.
Yes, absolutely.
We are selecting for virus or for bacteria that are resistant to a whole bunch of things.
And I would just say that, you know, one of the things that we certainly want people to do is to take it, you know, if you need to get care, that you should not defer getting care. There's still heart attacks happening, strokes that are happening, and people should not, you know, delay that kind of care.
What is the ETA of the next two vaccines?
So what we've heard about from Johnson & Johnson is that the data should be coming forth fairly soon in the next few weeks, and I think that it has, you know, obviously it has to go through that FDA review process. And so that's probably going to be somewhere February-ish. But again, then the distribution process has to happen as well. So
what is the efficacy of the J&J one-dose shot?
We don't know.
We don't know yet. That's what we're waiting on.
Okay, Merck has halted their vaccine research. Are there any others that seem promising?
Yeah.
I think when I last talked to Hotez, of the 150-ish that they started working on, they were down to about a dozen, and now Merck has stopped, so I don't know how many that is, but probably 10 or less.
Right.
Houston Methodist Research Institute investigation seems to show more men test positive and were more likely to be hospitalized regardless of age. Parkinson's is more likely in men. Could this be a connection?
Well, I think that's true, and a little bit unrelated.
Yeah.
The Hoya Institute of Immunology showed COVID survivors retain immune cells that can fight reinfection for at least 8 months and likely longer. Is there any unofficial consensus amongst your peers about the probable duration? I didn't think we knew that yet.
Well, I think the unofficial one that I've been hearing repeated about 3 months.
3 months is what I'm hearing,
8 months is generous.
BMJ Journal discussed the connection of GI tract and severity of COVID and noted the connections of the microbiome. You know the answer? Okay. Does this mean the bacteria is remaining in our intestines and could cause ongoing issues?
No, I don't necessarily. I think what I'm understanding is that obviously the coronavirus or SARS-CoV-2 binds to the ACE2 receptors, and those receptors are in the gut biome, and so that's why individuals can have some of those GI-related symptoms. Diarrhea, things like abdominal pain, things like that.
One last question. Repurposed drugs are extremely popular. Please comment on these statements. Dr. Corey calls ivermectin a miraculous treatment or obliterates the transmission of the disease and can be used as a prophylactic and early outpatient treatment.
The ivermectin.
Yeah.
So that, I'm a little bit familiar with that one. So the NIH has come out against, they had an initial statement recommending against the use of ivermectin. And just so you know, ivermectin is like a anti-parasitic drug. And so now NIH is basically saying now that they can't recommend for it and they can't recommend against it. So the jury is, still out. I do know that the critical care group is pretty adamant about showing good results for it. I think the jury is still out on it, though.
Thank you for joining us with COVID-19 Talk with local health authorities. Dr. David Persse, Dr. Sherri Onyiego. I'm Stephen Williams, Director of the Houston Health Department. Thank you to Kathy Finninger, past president of Rotary Club of Houston, who provides these questions. We'll see you next week.